Stories have been the foundation of human communication since the old times. Our next fireside chat will ignite your imagination and unveil the secrets of powerful storytelling and marketing. With the topic of the art of storytelling, crafting a narrative that leaves a lasting impression. Our next speakers, Ms. Brooke Cianciotta, I hope I pronounced that right, Brooke. Chief Marketing Officer at Acera Health, and also a Mr. Ethan Rasiel, CEO and founder of Light Speed Campaigns LLC. So up next, they will share some groundbreaking insights about immersive storytelling and how you can use it to present your brand and drive business with success. So please help me welcome to the stage Brooke and Ethan with a round of applause. Guys, the stage is all yours.
Sit here?
Yeah, let's do it. Let's do these two. Okay.
All right.
Hi, Brooke. Nice to be back with you.
Yes, thank you, Ethan. Hi, good morning, everyone. My name is Brooke Cianciotta. I'm the Chief Marketing Officer for Acera Health. We are a primary mental health treatment facility in Newport Beach, California, and we service first responders, police, fire, EMTs, and acutely mental health clients coming straight from the hospital. I'm also the Director of Business Development for WebServe. We are a digital marketing agency that is specific to healthcare. And then I was last year elected as President of CASA, which is the California chapter of NATAP, which works with our policymakers in advocacy and behavioral health.
Thanks, Brooke. Hi, everybody. I'm Ethan Rasiel. If I haven't met you, I'm the CEO and co-founder of Light Speed PR, based in New Jersey. We help technology companies of all sizes tell their stories. So Brooke is a storytelling expert. We're storytelling experts, but we have very different stories that we tell. And I think that between us, we have some great ideas and inspirations and suggestions for you on how to do your own storytelling. So, yeah, respect. Yeah. Oh, I just hit the microphone. Yeah. Yeah. So what we thought we would do is I'll interview Brooke and we can hear your story, and then we'll trade, and you can talk to me. And please, if anybody has questions that you want to ask at any point, you could jump in. We want to make it interactive. Sound good?
Absolutely. So since we're discussing storytelling and marketing today, I thought I'd tell you a little bit about my personal story and why I'm so passionate about the work that I do and why I really entered this field. So when I was a freshman in college, I got very sick. I got diagnosed with a kidney condition, and I was in pain, and I was referred to a pain management doctor on the Upper East Side of Manhattan on 5th Avenue. That doctor prescribed me 480 oxys a month, so 18 a day. And so before not too long, I was hopelessly addicted to opiates because I trusted that doctor. I had no reason not to. This was before it was in the media that it was not a good thing to do. So hopelessly depressed, and I knew that I needed treatment, and I didn't know where to find it. So the first thing that I did was I got online and I searched for treatment facilities in New York, which is where I was going to school at the time. I was far away from home. I'm from California, and I really didn't want anyone to know what I was going through, so I trusted whatever I could find online. Turns out there were no resources in New York at the time. The only thing I could find was a methadone clinic, which is not what I wanted. I wanted to be free from these substances and from the depression that I was feeling at the time. So I found a facility in California off a website, probably because they dumped a lot of money into their digital marketing, and it looked good on the website, and I thought it was going to be, a solution to my problem. Turns out this particular facility was the opposite of that. It was unethical. I was actually sexually assaulted in this facility, and they later got raided by the FBI and are shut down, so you'll be happy to know that. But I was able to find, since I was in California, I reached out to a friend, and I was able to find a direct referral to an amazing facility that changed my life, saved my life, and gave me a purpose and a passion for my life, which is, I knew at that moment that I wanted to help other people that were struggling with substance abuse, mental health, and now this additional trauma. So how did I get to do that? So I knew that we needed to change the digital marketing space around treatment and healthcare in general. We needed to lead business development teams ethically, admissions teams ethically, so that when they're speaking to clients, we're saying and doing the right things and providing quality care and access to care for clients.
Well, thank you. I want to first thank you for sharing that story. I think it's amazing, and especially how you've used the trauma that you went through to help others and kind of make sure that others don't have the same negative experience that you did. I think it's very powerful. But what I want to hear a little bit more from you about is, for marketers, you're a marketer.
Yes.
What's the most powerful marketing tools that you have that you've been able to create based on your experiences?
Thank you, Ethan. I think for me, the most powerful marketing tool that I have is my story. So when a client calls in and I answer the phone and I'm able to offer that patient hope and a solution to the suffering that they're going through, there's nothing more powerful. I do openly and honestly share my story with clients and families and other referrents in the community, hospitals, other treatment facilities, and that's really how I use storytelling in marketing every day to reach my target audience, which are patients that are really suffering. And this might be the only phone call that they get, and so I want to connect with them quickly. And I'm able to do that in under 5 minutes by telling my story. Because at the heart of it, it's really empathy, and I understand what they're going through, and I want to offer them hope.
Yeah, that's really amazing. Tell me a little bit more about your facility in Newport Beach. When we chatted yesterday, I thought it was really fascinating how you have some unique elements of it. What makes it different from other treatment facilities?
Yeah, thanks, Ethan. So our program is very special. We focus on, first, the mental health aspect. So we are treating clients in a home. It's a beautiful house in Newport Beach, and we have a staff of amazing doctors and all master level and above licensed clinicians that most are either in recovery themselves, or for our first responders, they worked 4 departments. My chief clinical officer worked for LA City Fire, and she really helps with our first responders that are struggling with complex PTSD from the job. So really what makes Acera different, it's small, there's 6 beds. We have 2-to-1 client to staff ratio. We care about them, we treat them with love and empathy first, and compassion. I truly believe in ethics in this space, and so every person that comes through that door is going to be really treated with love.
It sounds pretty unusual. Is this, as far as you know, is anybody else doing this kind of treatment in a home in this kind of small environment?
Yes, so there are some amazing providers throughout the country, and I've had the privilege and honor to vet some of the best facilities in the country. I've traveled all over the country, and actually at this point all over the world, finding resources for patients, because Acera Health is not going to be the fit for every client, but I want to make sure when they call on my admissions line that they have the resource that is going to be the best fit for them.
Great. Well, when you're dealing with the patients, we're here talking about storytelling, and you have your story and I have my story, but your patients all have their own stories, and those stories often are never told.
Right.
And so how do you get them to open up and tell you those stories, which are deeply personal? How do you get them to share that with you?
Right. So I lead an amazing admissions team, and the goal is to cut deep very quickly and get to the heart of the matter. We do that by having the client open up and tell us what's going on so that we can help them. Really, you know, the way that I use their stories is when we have an amazing outcome, right? They've finished treatment, they came in, maybe they just had a suicide attempt and they were, you know, addicted to meth, and they finished 90 days of treatment and they're doing amazing, and then a year later they just had a baby, they have a family, they just got their dream job, and they want to share that story, and so that content is invaluable to us. If of course, if they're willing to have us use that, we will put their testimonies on our website, because it's the most important content we have. Their stories, their successes, their outcomes are what's going to connect to the next patient that's struggling.
Yeah, I see a question.
Brooke,
Yes.
first of all, God bless you, and I'm sorry that you had gone through what you experienced, but I'm so glad that you're able to have overcome it, triumphed, and be in the position you are to be able to influence other people, so I applaud you for that.
Thank you.
As somebody who's also in the healthcare sector, and I've traveled, I've been to nursing homes, I've been to hospitals, I've been to rehabs, assisted living, you name it, all over the world, very similarly, you know that there is a huge gap between the places that people should go to and the places that like you wouldn't send an animal to, right?
Yes.
So, you know, is there any tip or advice, or I mean, it's not marketing related, but it's related to what we're discussing here. Is there any tip or advice that you would offer to somebody who's looking to get help for a loved one? Like what is a question that they should ask, or where can they find the good places versus the not so good places?
Yeah, thank you so much. It's an amazing question. So for me personally, that's why I spend years vetting facilities myself personally. I want to meet their clinical team. I want to see their houses. I want to touch the sheets. I want to know what kind of care that they're going to receive, so that I can tell a patient calling, hey, I've been there, I've seen it, and you're going to receive quality care there. But in addition to that, so I'm, like I mentioned, president of CASA, and we work on advocacy. So the national organization is called NATAP, which is the National Association of Addiction Treatment Providers. And it's an advocacy group, and we work with our legislators on policy change. So I was actually just in DC last month at meeting our state officials for California to advocate for parity, which is access to care for people that don't have insurance, and advocating for Medicare clients, that right now there's no benefit under Medicare for clients that need residential treatment. There's just hospitals and outpatient, and that's not enough. So there's organizations out there that are advocating for these vulnerable populations, because they are vulnerable. And you can reach out to these organizations, and they have vetted lists of providers that are excellent.
Thank you.
Yeah, that's a great question. I have one more for you, and that is, when you're doing your kind of external storytelling, how do these stories translate to the digital world, to social media, or to the website? How do you make that work for the public?
Yeah, absolutely. So it was very important to me to partner with a digital marketing agency that I knew was ethical. And actually, WebServe, the company I work for, the two owners are in long-term recovery. They're personal friends of mine, and they truly believe in ethical marketing. And so the way that we do that is we use paid media through ethical sources like Psychology Today. We offer SEO and PPC services just like most digital marketing agencies, but they're vetted. And we know what stories we want to tell. And one creative way that we're doing that is by using, we've created questionnaires. So for example, last month we created a questionnaire for clients that are undiagnosed with schizophrenia. So for families that maybe have a 19-year-old son, and all of a sudden they're seeing and hearing things and hallucinating, and they want to know what's going on. It's a resource that they can go through and fill out this questionnaire, and it's vetted by a clinician, created by a clinician, and then sent to a clinician so that they can get honest feedback on their answers. So That's one way.
I love the questionnaire. I just want to dive into that a little more.
Yeah.
What kind of response rates do you get? Do you have a percentage? Like, do a lot of people fill those out?
Yes, you'd be surprised. It's actually one of our most used tools, and it directly leads to sales. So in your last discussion, I was like, well, we want sales, and actually this type of marketing, for Acera leads to millions of dollars a month in revenue. It really does work.
Do you feel, it's interesting that you just mentioned sales, because it feels like you kind of have two aspects where you're here to help people and improve their lives, but then you also have a business obligation to profit and make money.
Yes.
Do you ever feel like there's a conflict between those two sides, and how do you reconcile that?
Absolutely. So, Acera Health is very special. We offer very specialized services. That's expensive. And to have all of our clinicians, you do need a certain level of resources or private insurance to come. But the way that we rectify that is, it doesn't matter if someone is calling and they have Medicaid. I will find a resource for that client, even if they have zero money, zero resources, and they're homeless. We will spend an hour on the phone with them to find them the resource, because this is a human being. And you know what? Doing that work, it just somehow it comes back to you. Yep.
Karma, right?
Yeah.
Good karma. It all comes back around.
It does.
Any advice that you can share with our fellow marketers here on maybe some of the learnings that you've had over the years of doing really both of these things?
Yes. So
Sorry to put you on the spot, but I wanted to ask that.
So the best thing that I learned in leadership and marketing is something that was just touched on in the panel this morning, and that is, every person on my team is amazing. They have a story and they have a talent that is going to connect to someone that is going to change their lives. And honestly, they know a lot more than me, and I learn from them every day. And I think the most important thing for me is to always learn and to always get better and to always find new resources and stay current and try and do the best possible for every patient or client that's calling.
Wow, amazing. Well, thank you for everything that you do. Yeah. Okay, any questions for Brooke before we flip the script and she's going to ask me some questions?
And I'm not as good as Ethan because I didn't memorize the questions. So, okay, Ethan, what are storytelling mistakes that people should avoid?
Well, there's a lot, and I'm sure that you have encountered this, but there's a couple of kind of repeated issues that a lot of the companies that I work with have with their storytelling. The first one I would say is assuming too much understanding on the part of the audience. I'm talking about using jargon or using terms that people don't get. You have to simplify. So the first mistake is just being way too complicated. That's probably the most common mistake that I think I see being made with storytelling. And then the other one is actually not delivering a satisfying story. You told a great story about you had an experience and then you converted it into this passion that you have for helping people. That's a story. A story isn't, we have an awesome product, please buy it. That's not a story. Or we're the best. That's not a story, right? Stories, whether you're telling it as a marketer or whether you're telling it as for a book or for a movie, there's certain common elements that a story must have. You want to have a protagonist. You want to have an antagonist. You want to have some conflict. Your story had a great conflict in it. Stories need conflict. Stories should have a twist. Your story had a twist. It definitely had a twist. Your story needs to have a satisfying ending. Make sure that if you tell a story for your brand, that it has all the elements of great storytelling, not just self-promotion. And that's a lot of my clients come to me and they're like, our story is that we're awesome. Sorry, but you might be, but that's not a story. That's a claim. So stories need to have stories. So yeah, that's my answer for that.
Ethan, what is the process that you use to create a narrative for your clients?
Yeah, well, we actually have had to create a real, it is a process. And we have to actually, the first part is to get people to actually stop and think about, what is the story? What we do with our clients is the first thing we do is we gather them all into a room. And we're doing them on Zoom now, but I think it worked much better when we were in the same room together. And I would recommend that when you're doing this kind of discovery process, that you really do it in person if you can. It's so much, we're here, right? It's so much better to do things in person if you can.
Absolutely.
Right, Zoom is just not good enough for this kind of stuff. People just are so much more thoughtful and clever and creative when they're in the room with other people. And the other thing is, when I do marketing, I'm usually talking to other marketing people. And that's great, but when we do our storytelling, and I'm sure you had the same experience, you don't want to have, the input shouldn't only be from other marketers. We want to bring in the salespeople, we want to bring in the product development people, we want to bring in leadership, we want to bring in all the stakeholders, even if they're not going to be part of that marketing effort later. When we do that message development, we want to bring in all of the key areas. And there's a couple of good reasons for that. The first reason for that is those different perspectives are really valuable. Marketing perspective is one thing, but we want to go way beyond that for that input to define the story. And the other reason is that then, when we've created that story and now we're out there, putting it out into the world, all of those people, they feel like they were invested. So, it could be the CEO, or it could be the finance team, or the sales team, or whoever it is, the investor relations people. We try to give HR, we try to give everybody a seat at the table in that message development session, so that later they can't be like, I don't agree with that. That's wrong. They're like, they were there. So everybody gets buy-in, and then we get their input, and then everybody's happy. That works a lot better for us.
Amazing. Can you tell me an example of a client that you have helped with their story?
Well, we had a client that had a piece of technology that would, actually I'm not going to tell you about that one. One of our clients is called, one of the clients that we work with is called Molly Surgical. And they have a device that detects breast cancer tumors.
Okay.
And they're saving life for women. And this technology is used by surgeons. It's very complicated. It's very sophisticated. It's not easy to understand. So one of the key breakthroughs that we had was to be able to explain this to people just in plain English, and explain to women why this tool, it's called wire-free technology. It's much less invasive, much less painful. So if you're a woman and you are interested in breast cancer screening for a tumor, make sure to ask your doctor for wire-free technology. And Molly Surgical is one of the companies that provides. They're the pioneer in wire-free tumor locating technology. Much less painful, much more comfortable. And we brought it down to a human level. Instead of talking about the science and instead of talking about the technology, we talked about the benefits. That is the most important thing to remember when you do your messaging. Make it about benefits. Don't make it, it's especially, I work with a lot of technology companies and they always want to talk about what we call the speeds and feeds. All of the technology that went into it. Yeah. But that doesn't really matter. What matters is how you use it, what are the benefits, how is it going to improve your life? So that's what we do for a lot of our clients is focus on the benefits and do it in plain English.
I love that. Does the media accurately present the story you're trying to tell?
I wish I could say yes all the time. Usually they do. The thing with journalists is they're just people like us, and they don't really, there used to be a thing called a fact checker. That doesn't even exist anymore. That's been downsized. These journalists, whether they're writing for whatever, BuzzFeed or whatever they're writing for, CNN, they write the story. Sometimes there's not even an editor. They just publish it, and that's it. So you're relying on one person who's doing 10 articles that day.
Right.
And sometimes they get it right, sometimes they don't. There's a few things that we can do to make sure that the stories are as accurate as possible. One of them is to really spend time with the reporter and make sure we repeat our key messages multiple times. When we're doing that briefing, we want to really, it's human nature. You're going to miss things. So if it's really important, we say it 3 times. Yeah. Not because they're dumb, it's because they're in a rush and they're multitasking. They probably got 6 other things going on. So we're repeating those key messages, and then we're following up with them and recapping them again. And then when those stories come out and when they appear in the press, we need to actually read them right away and scrutinize them if there is an error. And this is something that all of you can take away as advice. If you ever have a newspaper article written about you, or a magazine segment or a blog, and there's a mistake, you have the right to reach out and ask for a correction.
Yeah.
And a lot of people think, oh, well, it's too late, they got it wrong. And look, if it's in print, they can print a correction the next day, but it's hard to retroactively change it. But that's the beauty of the internet. They can always just revise it, the website. So even if there's mistakes, it's not too late. Reach out and get it corrected. I'm sure, in your experience, people sometimes get stuff wrong. Yeah. So you can reach out and get it corrected and get it updated, and all set from there.
Amazing.
Anything else you want to ask, or should we throw it out to questions
I'd
from the
love to
audience?
hear from you guys, or how you use stories every day in your marketing. If anyone has any comments or feedback or questions.
I'll throw it out. I love using client testimonies. I think you were talking a little bit about that before, where, again, your session earlier meeting was fantastic, and then even Brooke with your own personal experience going through it. So I love using client testimony because that's social proof.
Right.
Whatever it is the product, whatever it is the company that we're selling, whatever it is that we're representing, people who are paying customers, or people who in your case have received the benefit and they're now on the other side of the traumatic event that happened to them, they're the best, they're the raving fans, right?
Yes.
Fan is short for fanatic, right? They're the fanatics that are out there that are promoting and advertising for you. So using the stories of people who have gone through it and taking they walk the walk, makes it a lot easier to convince other people to take that same walk and journey with them. So I love using client testimony. I'm actually going to talk about that later.
Yeah. What's your name?
Steve the Hurricane.
Steve the Hurricane. All right. Well, thank you for that. Did you
Hurricane.
want to say something about that?
Oh, no, I was just going to say I do that every day, and I think our clients are our advocates, and they're the best people to tell our story and their experience. What was it really like, and how did this change my life? Because that's what people relate to. People are going to relate to their story. I love that. Thank you.
Yeah, I want to say something about that too. So Steve, thanks for bringing up testimonials. Like Brooke said, that's really important. This is honestly something that I try to do for almost all our clients. And some of them, it's very challenging. Sometimes the customers don't want to talk. Mm-hmm. Now, you know why? Now, if it's, hey, I bought this, your microwave was the best microwave, people are happy to share that. But what if my client has a unique innovation and the customers who are using it don't want other people to know about it? Because they're benefiting it and they're like, I don't want to share that. I have a secret advantage now. So sometimes it can be a real challenge to get those testimonials. And what we do is we anonymize them. Or we take it on an aggregate basis. We say 4 of the 5 top companies are using this without saying their names. Testimonials are huge. I also recommend influencer programs. For those of you who don't use influencer programs, these are basically paid testimonials, but you can monetize people to speak on your behalf. You can give them either a commission or you can give them a small fee, but that's essential. Testimonials are honestly like half the battle for me. Yeah, thanks, Steve. Did I see another hand? Any other questions? Okay. Brooke, any parting thoughts you want to, looks like we only have a couple minutes here, but any parting thoughts you want to offer?
Well, just that, I think when we're thinking about storytelling, it's that human aspect, right? We want to tell human stories that are universal to everyone. I mean, I think for me, substance abuse and mental health affect everyone, and even for your example with your company, I mean, most families know someone or have a family member that was affected by breast cancer. So really honing in on those human stories that people can relate to, and people can really see the benefit is the most important thing. So that would be it. Thank you.
Yeah, I'm gonna add one more final thought, and then we'll wrap for today. So thank you for that. I wanted to say one more thing about storytelling, and that is a good story never ends. And I mean that in really two ways. First of all, it never ends because there's always a new chapter to tell, right? There's always something happening, and so the other thing is, the way that you tell that story can always be evolved. So as you determine whether it's for your corporate story or personal story, you control that. You own that, and no one else owns that for you. And if you want to change it, even if you want to change chapter 1, I'm not saying fictionalize it, but you can emphasize what you want to emphasize and de-emphasize other elements and make that story your own. And if you're doing corporate storytelling, for our clients, we have a thing called a boilerplate. The boilerplate is the thing at the bottom of a press release, which is like the quick summary of that company. And that never stays the same. Every couple of months, we're updating it, adding new information, making that story better. So just remember that your story, it should be what we call a living document. It's always being upgraded, it's always being improved, it's always being polished. And as you have more success, that story gets even better and better. So don't think of it as we've got to get this story, get the story done. Okay, our story's done, now let's tell it.
Yeah.
It's never going to be done.
I absolutely agree with that. And I would say, whatever product or service that you're marketing, the goal is that it's always improving and it changing and getting better. And so you want to constantly put that out there. What are you doing today that's new and fresh? And what's innovative about what you're offering today? So.
Yep, that's right.
Yeah.
Okay, well, thank you so much for talking with me, Brooke. I think your story is inspirational, and I really appreciate your inviting me to come join you for this.
Oh, thank you, Ethan. Same. I appreciate it.
Okay, thank you, everybody.
Thank you, guys.